So I'm gonna go submerge myself in next. I'm gonna strip down and show you guys what's going on. So I'll be back. Beautiful Nicola here. It says Irnie Racing to Health. Anyways, my name is Marcel Irnie, pro Canadian Superbike racer with a herniated disc bulge plus 15mm annular tear posterior left in a radial tear from the inside out from picking up a torque converter December 8th over 4 months ago. And this is rehabilitation.
Irnie Racing for Health.
Irnie Racing for Health. Yeah, my mom's like, you should make a health channel or a subdivision, a subcategory.
It should be Irnie Racing to Health. That is what you're doing, dear.
That's right, to health.
To health. And you're plunging into that water and I'm reading my Sufi.
That's right.
In the sun.
And you're able to walk on your heels and your toes and do a deep knee bend, all those sorts of things?
Yeah, I have full mobility. Like, as an example, I can bend and touch my toes. Like, I feel the pain, but it's not like preventative pain that'll stop you from doing the movements. It's just, you kind of try to be careful about it. I just realized that I haven't been icing my back nearly as often since doing these Wim Hof techniques of the cold water. Like every morning, all day long, I used to sit here and use the heating pad. Of course, start with the heating pad and then finish on the ice all day long, over and over and over and over and over as I suffered from my back pain. And guys, this morning, I'm feeling really good. I mean, like, I could say the pain is at 0, but it'd be more technical. It's like 0.5. It's a little there, but it's almost like normal life, maybe. Like, when you just have a sore muscle from freaking a hike. So, wow, really impressed. I did the breathing technique this morning as well, just because I was relaxed. And I tried using it through my nose and just do a more relaxed version, because my most difficult part is the intake of air through my throat. That's the most annoying part, is it itches my throat. But, yeah, guys, another hike today. Awesome. Hey guys, it's Marcel Irnie back at ya at another outdoor location in the Nicola. Gonna continue my Wim Hof cold water submersion to reduce my nerve back pain from my L5 S1 herniated disc bulge with a 15mm radius annular tear posterior left. That is toxic, a toxic annular tear that has been driving me crazy for over 4 months now. It is, become chronic now for a while. Chronic pain is defined as 12 weeks and longer where a pain becomes subacute to toxic.
Well, I looked at your MRI, and fortunately it shows many good things. It does not show any significant disc herniation or nerve root pinch. The alignment is good. So, structurally speaking, that MRI advises us not to do any surgery there. Surgery would not change your pain at all.
I see what you mean. It's not pushing into like the lateral nerve at all, like the bulge or where the annular tear is in the posterior left. It's not bulging much, maybe like 6-7 millimeters when you're on the sagittal view on the left side. But what do you think about like the annular tear on the posterior on the axial view? I measured it around 14-15 millimeters. What's your opinion on that?
Well, surgery is never used for an annular tear. There's no surgery for an annular tear. Treatment for this MRI and for your symptoms is all non-surgical. It would be the options are medications, which you're on. You've been doing the physiotherapy. The only other option that I haven't heard is a steroid injection in the back, but there's no surgery indicated here. No surgery would change your symptoms at all.
What is the best way to diagnose a toxic annular tear? The gold standard is a CT scan after a discogram. This is in the operating room, so a discogram is performed in a sterile environment in the operating room with fluoroscopic x-ray to place the dye. Looking at the left hand, we see the disc bulge here. Absolutely no comment on the MRI report of any type of annular tear. and the lady had chronic back pain after a motor vehicle accident. And here, here's the dye from the discogram, and then here we see the dye leaking out the back. Absolutely an annular tear, not demonstrated at all by the MRI scan. In this case, we do see a high intensity zone here on the left, and the other discs look actually fairly good or okay. This is a darker disc, and we don't know if this is causing the pain or not, but we can see here that there's an annular tear here for sure, and it did correlate with this person's pain as well at L5S1. Example 3, again, here we have a disc bulge, and here we have a disc, actually a little small protrusion, herniation, and if we, after the CT, we can see that the herniation didn't really give rise to any type of annular tear, but the level above that looked normal and read as just a disc bulge on the MRI scan is leaking dye out the back for sure. And here's the axial view, so we can see the dye coming straight out the back and a little bit over here to this side as well. Now we have a diagnosis. So the diagnosis starts with imaging, X-ray, you might see some end plate changes, MRI, we can see the high intensity zone, HIZ, a dark disc, maybe modic changes of the end plates, discogram, provocative, annulogram means we put some dye into the periphery of the disc and then follow it with a CT scan. Keep in mind that the MRI slices are 3 to 4 millimeters, which may account for the negative MRI scan if the tear or granulation tissue is too small to be seen. The high intensity zone just suggests a problem. It doesn't confirm it's the source of pain. Well, there are two main issues. The healing environment in a disc is not optimal at all. 1, poor blood supply. 2, low oxygen content. 3, it's a low pH, it's acidic. 4, high tensile strains. In other words, the back is always moving, so it can't be held still to try to heal itself like other parts of the body can. Issue 2, free-floating fragments inside the disc. The free-floating fragments can give rise to 3 different problems. Mechanical problems, number 2, chemical response to the fragments to try to resorb them, and number 3, an immunogenic sensitivity when the body responds to the fragments. When I put a scope inside of a disc, these are the free-floating fragments. These are just floating around inside the disc. They're not anchored to anything. And it's usually a very sizable amount of material that comes out of these discs with a symptomatic annular tear. So here's the disc material here is from lumbar 3-4 disc, and here's one from lumbar 4-5. And you can see that it's almost 3/4 of an inch or an inch of just a pile of fragments. And these took no effort to get out. They just put the scope in, as we're going to show here in a couple minutes, and these just pile right on out. Inside the disc, I have stained with methylene blue to help visualize exactly what we're seeing. Now, this is the scope inside of a disc, and you can see that I'm not doing anything. These fragments are just piling out of here. The blue is from the methylene blue staining, and it's a acidophilic dye that stains the nucleus, nucleic acids of the dead tissues, so that anything you see here that's blue is dead. Now, again, we're looking in the inside of a disc, the vertebrae are to the right and left, and I'm doing very little here to actually just, I'm just teasing the tissue away, but you can just see how many fragments are just piling out of the inside of this disc, and it ends up to be a pile on the sponge like I showed you before. But the blue color is just so that you can see a little bit better. But you can see I'm really just very gently doing hardly anything. And look at all this blue material coming out from inside the disc. This is a classic annular tear. And you can see the tremendous amount of free-floating debris. So the body responds, again, chemically to the free-floating fragments here. And it also, the one thing is the disc may not be immunogenically privileged, so it can engender an immune response. So this is a picture of the fragments, actually probably more but you can see them all stained blue, and this is exactly what's inside, floating around the inside of a disc with an annular tear. Very typical.
So I'm gonna go submerge myself in next. I'm gonna strip down and show you guys what's going on. So I'll be back. Beautiful Nicola here. And I just want to note that my pain is at a solid 3 out of 10 right now, where it's really annoying. It's there. I want to put some ice on my back, or start with heat and then ice if I was hanging out and I didn't know about this technique. So let's get in the water before we do our hike and get some results here. So let's get at it. Yeah. I'm gonna do the Wim Hof breathing exercise, then I'm gonna go in the water, in the river. So let's get her done. Let's get her done. Yeah, and I've definitely read up about that, and injections or possibly nerve block injections to kind of like figure out where the pain might be coming from.
Well, there's no nerve block injections because that's for a nerve root, and there's no nerve root being pressed here.
Okay,
so the injections would be facet injections or epidural injections.
Yeah, which could give me relief possibly for a week or a month if it's done in the right spot.
Well, even up to months, yeah. Sometimes up to 3 injections per year, and the effect of them can be for months. Sometimes they don't help at all, but often they do. And that's really the only option here that you haven't tried yet is the pain clinic cortisone injection. So I think that's the next place to go.
Just took a breath. Oh. Oh. Holy crap. But I'm not fully submerged either. That's the other problem. Oh well, it is what it is. Oh. 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 Oh, I don't want to. Oh, this is good enough. I'll put my head in. Oh. Oh. Woo! Ah! Oh, oh, oh. Oh, that's cold. Oh, oh, I don't know how he does it. Oh, 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 holy crap. Oh, oh, ah, 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 oh. Okay, I'm not having fun. I'm not having fun. Oh. You know, from what I've been studying, the annular tear, it's possible that it has like a chemical reaction with possibly like the recurrent nerve, the synvertebral nerves. Is this common?
I don't think so, no. I think this is all inflammation in the facet joints and irritation of the nerves that innervate the ligaments of the spine, those sorts of things.
And that's why the pain kind of moves to the sacrum.
Hi, I'm Dr. Tony Mork, endoscopic spinal surgeon, and for the past 13 years, I've dedicated my practice entirely to the cure of chronic neck and back pain without the use of a fusion. Today, I'd like to talk about facet syndrome or spinal arthritis. The problem is as a result of the facet joints, and the facet joints are the guiding joints in the back of the spine. They occur, this is the back, or the little bumps on one's back where you get a massage. These are the little facet joints off to the side. In the front, we can see the discs here between the vertebrae. But let's talk a little bit why the facet joints would hurt. The facet joints are actually lined with synovial tissue, which has got a fairly good and sensory nerve supply. In addition, the joint is covered by a capsule, and the capsule has a very sensitive nerve supply as well. These both act to restrain the motion of the back. So in addition to the nerve supply telling the brain where the back is in three-dimensional space, and the bone acts as a bumper so that it restricts our range of motion, say when you're swinging a golf club, that you just don't keep twisting around. The problem becomes one of aging, where we begin to lose the water content in the discs. The facet joints get off-center, and when that occurs, bone-on-bone contact can occur, pinching of the soft tissues, the synovial tissues in the joint can occur, and stretching of the capsular tissues can occur as well. In addition, osteophytes, which is again another byproduct of arthritis, can occur, and these can actually pinch the soft tissues as well. In my experience, the back begins to hurt in the morning in particular, with a feeling of stiffness and pain that's off the midline. So it's not directly in the center like the disc would hurt. It's a little bit off to one side or the other or both sides. And initially it can be dealt with rest. Maybe anti-inflammatories will carry you for a few years. Things like golf and twisting can be aggravating, as is extension. So when you lean back, oftentimes that will aggravate a facet problem. If symptoms persist, you oftentimes might find yourself in a pain management office, and where injections of maybe Novocaine and some cortisone can occur. This helps to make the diagnosis and may treat the problem on a temporary basis, maybe from 3 weeks or 3 days to maybe a year. It's just unknown, but at least it helps to make the diagnosis. If that doesn't work or it lasts on a temporary basis, the next treatment is usually radiofrequency. This is done with placement of a RF or radiofrequency probe by the pain management doctors down into the area of concern near the nerve supply. And the radiofrequency will block the nerves, and only on a temporary basis, which is the problem. It can last from a few months to a year, and then the pain starts to come back. So if this sounds familiar, maybe you've sought out a more permanent kind of a solution and stumbled over the fact that one permanent solution is a fusion, which in my opinion is a tremendously large operation, long recovery, and only working maybe 2/3 of the time, a pretty dramatic time of a fix, maybe creating more problems than you're solving. I began to look at the problem in a different way a number of years ago. With the endoscope and looking directly at the facet joint, I could see that the problem was this pinching of the tissue. So with the laser, I began to actually remove the tissue from inside and actually remove a portion of the capsule, which conducts the nerves. And between this, I began doing this in the cervical spine, thoracic spine, and lumbar spine. And over a period of time, I got to see that the patients seemed to do fairly well. As a matter of fact, last year, my associate, Dr. Scott Hoff, and I got this paper published in 2010, which is the original paper talking about endoscopic facet debridement with the use of a laser. And in this paper, it was noted that in a combination study of cervical, thoracic, and lumbar facets, that between 68 and 77% of the patients had at least 50% relief of their pain after a minimum 3-year follow-up. So people were getting rid of at least half their pain 3 years out at least. So it was long-acting, and it had very, very safe. There's really minimum of complications noted.
Well, that wasn't right now. I don't know. I don't feel as good not going the full body. Like half my body is like affected by it and half's not. You feel the cold on your brain for sure.
Does he put his head in?
Oh yeah, well he submerged himself under the freaking ice water and swam.
Oh, I see.
And then, yeah, he almost did 2 hours. I believe his head was out for the 2 hours when he was in an ice bucket and he was in the city. People could watch him in a clear bucket full of ice. He was in pure ice. Can you imagine? Pure ice. We're talking about Wim Hof, one of his Guinness records. He actually put himself to the scientists so they could test him, all sorts of tests to verify and prove that he is able to control and regulate his skin temperature to a nice 37 constantly. Well, I don't feel any back pain, but the real test will be we'll go for a little walk and I'll see how I feel when we're hiking. So I'm gonna get, it's windy, but I feel not too cold. But I think the test was like a half failure because the water wasn't deep enough.
Irnieracing for health.
Not to health.
No, for health, for yourself and for all those that are your sharing.
It's really Irnieracing to dirt biking, actually. Yeah, it's Irnieracing for dirt biking. That's my main goal. That ought only be pain-free and enjoy life, but to go dirt biking. I got my new helmet, new pants, new gloves. Now I got winter gloves for dirt biking. I wore them once. I wore them more for hiking. So well, they'll be there for next time. So, yeah, I got all this. I just 25 hours on that poor KTM. It wants to go ride. It wants to ride. Oh wow. Never mind. After stopping, my day's done. Yeah, it's yeah. All in the back side on the left and some on the right, mostly on the left. I'm done. Shit. My biggest fear is my back injury. Why am I on a roller coaster? You know what I mean? Like, why does it get better slowly and then just go right to hell?
Now the problem here is, of course, they're not active due to the pandemic, so it'd be a matter of whenever things open up again, they would be able to see you. But nobody's seeing patients now in the pain clinic.
Oh no.
So it may take a while, but let's get the ball rolling there.
And I was doing so well with the Wim Hof and the hiking the last few days, and then the pain came back to, 4 out of 10, say. And then I had another bath and cold shower last night, and then this morning I woke up with pain as well.
You need help?
No, stuff's happening.
What's happening?
I'm entering a mode. Does it look red from that?
Yes, it's red.
Oh, okay, just follow me back to the pit. That is cold. I think that's colder than the Nicola, maybe. I don't know. They're about the same. So, anyways, another day in the life of trying to deal with this horrible injury that I didn't even do anything to injure it, which is one of the other worst parts. I didn't crash a motorcycle. A guy like that. Whoa! Now there goes the bike. Didn't crash a dirt bike. Oh, yeah, that log was slippery. I knew it was going to be. Didn't fall off of a cliff. Whoa!
You're making me really nervous there.
All I did was pick up that stupid torque converter, and it didn't even hurt me at the moment. It just came on after. Got it. Woo!